Will the House please come to order and members kindly take their seats? Good afternoon. Members, we will start with three bills, which are S-190, which is an act relating to the Green Mountain Care Board and other topics, followed by House Bill 660, which is the opioid settlement bill, followed by H757, which is the manufactured homes bill. So S190, H660, H757, and then we will see if any other bills have moved out of committees to take up. So with that, member from Poultney. On our notice calendar is Senate Bill 190, which is an act relating to the Green Mountain Care Board, reference-based pricing, and studying the creation of a public employee health benefit authority. Can you please offer us a motion to suspend rules to take up Senate Bill 190 off the notice calendar for immediate consideration?
Madam Speaker, I make a motion to suspend rules in order to take up off the notice calendar for immediate consideration S-190.
The member from Poultney moves that we suspend our rules to take up Senate Bill 190 off the notice calendar for immediate consideration. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up Senate Bill 190 for immediate consideration. Senate Bill 190 is an act relating to the Green Mountain Care Board, reference-based pricing, and studying the creation of a public employee health benefit authority. The bill was referred to the Committee on Health Care, which recommends that the House propose to the Senate to amend the bill as printed in today's calendar. The member from Essex, Representative Black, will speak for the committee. And then affecting the revenue of the state, the bill was then referred to the Committee on Ways and Means, which recommends that the bill ought to pass in concurrence with the proposal of amendment by the Committee on Health Care. The member from Norwich, Representative Holcomb, will speak for that committee. And then carrying an appropriation, the bill was then referred to the Committee on Appropriations, which recommends that the report of the Committee on Health Care be amended as printed in today's calendar. The member from St. Albans Town, Representative Dickinson, will speak for that committee. Please listen to the second reading of the bill.
S-190, an act relating to the Green Mountain Care Board, reference-based pricing, and studying the creation of a public employee health benefit authority.
Member from Essex.
Thank you, Madam Speaker. Today I'm presenting S-190, which is a strike-all amendment, and you can find the bill on page 3612 of today's calendar. It was right about this exact same time last year that I stood here and I presented S-126. That was a bill that became Act 68. One of the most important pieces in Act 68 were the sections that required the Green Mountain Care Board to establish reference-based pricing for hospitals. To refresh your memory, reference-based pricing is a health cost containment model that sets a fixed maximum payment amount for specific medical procedures and services, usually based on a transparent benchmark like Medicare reimbursement rates. Act 68 says, the Green Mountain Care Board shall set rates to be implemented over time, beginning with reference-based pricing as soon as practicable, but not later than hospital fiscal year 27. Hospital fiscal year 27 begins October 1st of this year. That is 5 months from now. We were aggressive in our timeline because we were in a crisis, and we remain in that crisis. In fact, changes on the federal level have made that crisis even worse. This bill, 190, ensures that Act 68 is being carried out as intended in the time frame that was laid out. This bill will do 4 things. 1, it gives authority to the Green Mountain Care Board to start implementing reference-based pricing for fiscal year 27. Number two, it will help reduce insurance costs for those who need it the most. Number three, it will help reduce property taxes. And number four, it's going to help save your hospital. Number one, this bill and the amendment that you will hear later from House Appropriations Committee will allow the Green Mountain Care Board to commence with reference-based pricing for 2027 as intended in Act 68. The Green Mountain Care Board has been working diligently to finalize rulemaking, but due to the timing on putting out an RFP and bringing in a consultant, it will not be done in time for October. That consultant has been hired, is currently at work, and rulemaking will be finalized in January of 27. This bill allows them to proceed with commencement with reference-based pricing in a limited scope without rule just for 2027, as we intended in Act 68. They are prepared to do this. They are fully capable and eager to get started. They will continue to roll out reference-based pricing for the entire commercial market beginning in 2028 after their rulemaking has been completed. I'm calling 2027 reference-based pricing a soft opening. Number two, this bill will allow reference-based pricing in the qualified health plans, or QHPs, in 2027. The QHP is divided between the individual market. Those are individuals who have no options for employer-sponsored insurance. They're mainly self-employed. And then there's the small market, small group market. Those are small businesses who offer health insurance to their employees, but they are not able to seek self-insurance. The expiration of the enhanced premium tax credits at the end of 2025 has pushed Vermont's individual marketplace enrollees into impossible choices. The Vermont Department of Health Access own enrollment data tells the story. Vermonters have lost over $60 million this year in federal subsidies that began January 1st of 2026. Over 5,000 Vermonters have disenrolled entirely from the marketplace for coverage by April of 2026. That is 5 times the rate that was seen at the same point in 25. And of those that did remain, Vermont saw nearly twice as many new bronze plan enrollees as compared to 25. 60% of the new bronze enrollees came from gold plans. These are not new to market shoppers choosing bronze. These are Vermonters who are trading down coverage that they had previously chosen. When Vermonters trade gold for bronze, they don't just lower the premium. What they face is much higher deductibles and out-of-pocket costs when they actually do need the care. That is not affordable. There have also been no relief for the small group plans, and they have never received subsidies and have borne the greatest burden of ever-rising costs, often forcing them to provide high deductible plans to the Vermonters that work for them. Number 3, we know that one of the significant cost drivers in education funding is the increase in healthcare costs for our educators. This bill expands reference-based pricing to the Vermont Education Health Insurance, or VHI, and this will reduce spending and stabilize increasing healthcare costs for VHI. This will help our education fund, and it will contribute to lowering the tax burden that all Vermonters pay for education. Number 4, this bill will help hospitals. The financial pressures of Vermont hospitals that are facing is very but the diagnosis for that matters. UVMMC's losses since the beginning of this year, as described by their CEO, stem primarily from reduced utilization, not from insufficient commercial rates. The utilization problem will only get worse. It won't get better. And if we allow the QHP market to keep shrinking, when Vermonters can't afford coverage or they downgrade to high deductible Browns plans, they skip care. That means fewer paying patients, more bad debt, and more charity care. The exact conditions that further strain hospital finances. As costs increase, utilization decreases, and revenue falls. It is a death spiral. That is what's hurting all of our Vermont hospitals, not just UVM. Some hospitals may warrant a unique approach, and that is why in Act 68, we tasked the Green Mountain Care Board when establishing reference-based pricing to consider the community need when establishing that reference-based price. The goal of reference-based pricing is not just to rein in spending, but is to make sure that we're putting our money where it matters most. This bill, and particularly the amendment that will be offered by House Appropriations, will allow the Green Mountain Care Board to tailor that approach for each hospital. Keeping Vermonters insured and receiving care is the best thing that we can do for hospital financial sustainability. S190 is pro-patient and it is pro-hospital. I did want to describe something else that happens. When the Green Mountain Care Board does their hospital budget orders, they set a commercial revenue cap. What we see happening now is when hospitals start getting close to that cap or going over that cap, the only way that they can stay under the cap is to decrease access. They stop seeing people. If we do this bill, if we do reference-based pricing, that does not stop what the Green Mountain Care Board does. Your hospitals will have that same revenue cap. They will just not need to deny access to Vermonters because they're afraid of going over their cap. The bill also includes a report that it looks at the effects of hospital outsourcing as it affects the provider tax. And then there's some additional technical language in the bill. And additionally, members may have heard in the news that there's an issue regarding Medicare patients at critical access hospitals that affect how much that their cost sharing is for outpatient services. We're asking critical access hospitals to work with the Green Mountain Care Board for possible solutions and to provide transparency for patients and affordability. I'm going to now walk you through the bill. I'll get a drink of water. So section 1 is our reference-based pricing section, 18 VSA 9376. It requires that the Green Mountain Care Board to use reference-based pricing to reduce hospital prices incrementally in order to equal national median prices by 2030. It requires hospitals and health insurers to begin expressing their rates as a percentage of Medicare for items and services in provider contracts starting in January of 28. It directs hospitals to provide their publicly reported prices both as a percentage of Medicare rates and in dollars and cents, disaggregated by payer and by plan. And it allows hospitals to express rates as a percentage of Medicare based on the actual reimbursement rates the hospital receives from Medicare until the Green Mountain Care Board adopts reference-based pricing rule establishing methodology for determining those Medicare rates. It also requires hospitals to use a separate national provider identification on claims filed after October 1st for services that are delivered at each hospital department that is not part of the main hospital. That's a federal requirement. Section 2, I'm going to walk you through Section 2. And there's a lot of numbers, but I want to let you know that much of what is in the House Appropriations amendment will be changing a lot of this, so don't get too stuck on them. 9451 adds a definition of Medicare adjusted base rate for purposes for hospital budgets and hospital budget review. 9455 limits the amount that health insurers can pay certain hospitals for services provided to enrollees in qualified health plans and plans provided through the VHI. It does not affect critical access hospitals or Vermont's single federally designated Medicare dependent hospital. For fiscal year 27, hospital budgets allows the Green Mountain Care Board to direct an amount equal to 3.5% of the affected hospital's total commercial net patient revenue toward reducing reimbursement rates for QHPs and VHI plans by setting the rates as a percentage of Medicare. For fiscal year 28 hospital budgets, it allows the Green Mountain Care Board to set up reimbursement cap of $300 for Medicare rates for QHP and VHI. For fiscal year 29 hospital budgets, it allows the Green Mountain Care Board to set reimbursement cap at $250 for Medicare for QHP and VHI. It limits the amount that the insurers can reimburse the hospitals to give the Green Mountain Care Board rate caps for fiscal years 27, 28, and 29. If the Green Mountain Care Board orders a hospital to reduce its commercial reimbursement rates more than what is accomplished through the caps on QHP and VHI, then the hospital must next reduce its commercial reimbursement rates that are more than 500% of Medicare or otherwise the highest in relation to Medicare. That's meant to address the outliers. It directs the Green Mountain Care Board and the Department of Financial Regulation to ensure that the rate caps are appropriately reflected in the premium rates for the QHP and VHI plans. Section 3, 9407, outpatient prescription drugs. It increases 120% to 130% of average sales price, the cap amounts hospitals can charge health insurers for prescription drugs administered in an outpatient setting. That was Act 55 from last year, and that also will be removed in the House Appropriations Amendment. Section 4, Hospital Outsourcing Report. It requires the Green Mountain Care Board to direct hospitals to provide information in their fiscal year 27 hospital budgets about any clinical services that they outsource to external entities. And by January 15th of 27, the board will report to the General Assembly with findings and recommendations on hospital outsourcing and with the Agency of Human Services on the impacts of hospital outsourcing on Vermont's provider tax revenue. Section 5 is healthcare bargaining groups. It exempts the Green Mountain Care Board from having to negotiate with provider bargaining groups regarding the board's establishment of reference-based pricing. That's cleaning up existing statute. Section 6, around appeals to the Green Mountain Care orders, it eliminates the statutory language requiring the board to adopt administrative appeals procedures and requiring someone aggrieved by the board determination to exhaust those administrative appeals prior to appealing to the Vermont Supreme Court. Again, that is cleaning up language. Section 7 and 8, on data infrastructure health system performance tool, it directs the board to develop and maintain a public interactive tool showing information on health system performance, including quality, access, and affordability. Section 8 makes the requirement to develop the health system performance tool contingent on the Green Mountain Care Board receiving federal or other funds for this purpose. This particular idea was in the Rural Health Transformation Grant that AHS had, and it was approved by CMS for that purpose. So that is why those two sections are in here. Section 9 is critical access hospitals, Medicare outpatient cost sharing. It describes a federal requirement that Medicare beneficiaries must pay 20% of charges for outpatient services at critical access hospitals, not 20% of Medicare's allowed amount. And by September 1st of 26, it requires critical access hospitals to identify all outpatient services for which the hospital charges 5 or more times the Medicare allowed amount for the service. It must post a disclosure on their website and in outpatient departments of the hospital about the federal requirement and that Medicare beneficiaries may be able to get care with less out-of-pocket costs at a different provider, and how to contact the hospital's financial assistance department for more information. It directs the Green Mountain Care Board, if it wants to address the issue in fiscal year 27, to consider the proposals from the critical access hospitals and other interested stakeholders and ensure that its actions are consistent with ongoing transformation efforts and with the Act 48 principles of healthcare reform. And just to advise, this process is already happening. The critical access hospitals are working with the board to identify solutions to this. Sections 10 are the effective dates. The act would take effect on passage, except for the increased cap on hospital charges for outpatient drugs, which would take effect October 1st of 26. Again, that's going to change in the House Appropriations Amendment. And then there is a new bill title. It is an act relating to reference-based pricing and the Green Mountain Care Board. We heard from the Chief Medical Officer at Brattleboro Memorial Hospital, the Executive Director of the Vermont Medical Society, the Director of Policy for the Green Mountain Care Board, the Executive Director of the Green Mountain Care Board, the Deputy Chief Counsel for the Office of Legislative Counsel, the Executive Director for the Vermont School Boards Association, the Chief Healthcare Advocate for Vermont Legal Aid, the Chair of the Green Mountain Care Board, Senior Vice President of Policy and Strategy for the Vermont Association of Hospital and Health Systems, the Director of Legislative and Government Relations for Blue Cross Blue Shield of Vermont, the Chief Negotiator for the Vermont Educational Employees Healthcare Commission, a Strategic Analyst from the Vermont State Employees Association, the Senior Vice President of NFP, Political Director for the Vermont National Education Association, the Commissioner of the Department of Financial Regulation, the Deputy Director of Health Systems Finances for the Green Mountain Care Board, and the Director of Legislative Affairs for the Office of the State Treasurer and Ledge Counsel for the Office of Legislative Counsel. Madam Speaker, I went around my committee room on day number 1 of this session, and I asked every single committee member what their top priority was. Every one of us listed affordability for Vermonters as our top priority. I believe that this is the most important healthcare cost control legislation Vermont has considered this year. And I believe that it's vital that we pass this legislation this year. This bill is about affordability. I keep asking the question over and over in committee, what is the definition of economics? Economics is the allocation of scarce resources. S-190 is simply a reallocation of those scarce resources. We have the highest hospital prices in the entire country. We have the highest insurance premiums in the entire country. We have a QHP market in free fall. We have unsustainable property taxes, and we have a federal government that is actively trying to make things worse, not better. S-190 is our answer to making sure that we stay on the track laid out in Act 68, and we focus these early wins where it is needed the most. And it begins to reallocate those scarce resources back to where they belong. They belong to Vermonters. We have been talking about reference-based pricing for years. Act 68 set the deadline, and S-190 removes the obstacle of rulemaking and makes sure that the Green Mountain Care Board can actually do the work that we asked them to do in the time that we asked them to do it. Your Committee on Healthcare approved this strike-all amendment on a vote of 10-1-0, and we ask for the body's support.
And now speaking for the Committee on Ways and Means, member from Norwich.
Thank you, Madam Speaker. S-190 was referred to your House and Ways Means Committee for review. And Section 4, as was explained by the member from Essex, addresses, requires the Green Mountain Care Board, in collaboration with the Agency of Human Services, to report on the extent to which hospital outsourcing affects provider tax revenue, which is a matter of interest to the budget of the state. It also requires the board to recommend any necessary modifications of statutes to ensure that we appropriately reflect expenditures for patient care at Vermont hospitals, which could also affect the provider tax. Section 8, as was explained by the chair, also specifies that the Green Mountain Care Board shall only develop the healthcare system performance tool described in the bill if the board receives sufficient funding from the federal government or another source for this purpose. But I want to emphasize the larger overall potential impact. This bill accelerates cost containment work, but specifically for qualified health benefit plans and for school employees. At a time of great stress in our education budgets, this has significant potential to reduce education spending. To the extent the measures in this bill reduce the cost of care for school employees, that may have a positive impact on the cost of employee health care, and this reduces our education property tax burden. This may be the most significant work we do this session to curtail the growth in property taxes. We had the privilege of hearing from the chair of the House Committee on Healthcare, the Deputy Chief Counsel of the Office of Legislative Counsel, and the Principal Fiscal Analyst of the Joint Fiscal Office. We thank the Healthcare Committee for their work, and the House Ways and Means Committee found the bill favorable on a vote of 7-4-0, and we encourage the body to support it.
And now speaking for the Committee on Appropriations, member from St. Albans Town.
Thank you, Madam Speaker. The House Appropriations Committee reviewed S-190, an act relating to the Green Mountain Care Board. We did a read-through of the bill from the House Healthcare Committee that relates to the language for reference-based pricing. We also were presented with an amendment that the House Healthcare Committee prepared that made some changes to a couple of sections. There is no money in this bill, but House Appropriations Committee had an amendment that would allow the administration to consider submitting a state innovation waiver pursuant to the Patient Protection and Affordable Care Act of 2010. After some discussion, the Appropriations Committee decided to combine the two amendments, our amendment with the amendment from the House Healthcare Committee. I now yield to the representative from Essex, who will present their instances of amendment.
The member from St. Albans Town yields to the member from Essex.
Thank you, member. So I just wanted to say that this bill has been on a long path. There have been rigorous stakeholder meetings since the beginning of this session. They have included the House and the Senate, the administration, the Green Mountain Care Board, the Department of Financial Regulation, members of many, many committees, so many people in the room. One thing that was identified was we wanted to direct savings this year. Everyone agreed we wanted to work on affordability. It has had many, many machinations. There have been many numbers run, many discussions about how to target these savings, numbers changing, and the bill over time just kept changing and numbers were tweaked. And when it came out of your House Committee on Healthcare, we had voted it out, and then there was an identified issue that it wasn't prescriptive enough. And this bill is a bill about reference-based pricing. It is not a bill about the legislature inserting themselves into a well-established hospital budget review process. And that is what the bill had morphed into. So I presented an amendment, and I had presented that with the committee. I had several committee members who were signed on to that. And then I think House Appropriations, because when I presented my amendment to them, they felt like they wanted to include my amendment into that. So that is what you're seeing. So I'm going to just sort of talk about the first and the second and the fourth instance of amendment. So the first instance of amendment, it strikes out Section 2 from the bill in its entirety as recommended by the House Committee on Healthcare, and it replaces it with a new Section 2, but there's only a few main differences. The House Appropriations Committee version applies only to hospital fiscal year 2027. And while the House Healthcare version had applied to years 27, 28, and 29. The House Appropriation Committee version applies to all Vermont hospitals, while the House Healthcare version excluded critical access hospitals and Medicare-dependent hospitals. The House Appropriation version allows the Green Mountain Care Board to direct hospitals' commercial reimbursement rate reductions to the qualified health plans and the VHI plans, but it does not specify the percentage of Medicare that the board must use. The House Healthcare version had directed the board to limit the relevant hospital rates for those plans by certain amounts to arrive at a certain percentage of Medicare in 27, and then limit the rates for those plans to 300% in 28 and 250% in 29. The second instance of amendment from the House Appropriations Committee, it deletes Section 3 of the bill. In the House Healthcare version, this section would have increased the cap on hospital charges for outpatient prescription drugs enacted in last year's Act 55 from the 120 to the 130. Because we were removing the numbers and there was not need to tweak numbers by readjusting and calculating the important work we had done in Act 55. And then the fourth instance of amendment, it just amends the effective date to reflect the deletion of that Section 3, and the entire bill now takes effect on passage. I just want to remind everybody, as laid out in statute, the Green Mountain Care Board's charge must follow the principles of healthcare reform established in Act 48. Namely, they must ensure universal access to and coverage for high-quality, medically necessary health services for all Vermonters. Systemic barriers such as cost must not prevent people from accessing necessary health care. All Vermonters must receive affordable and appropriate health care at the appropriate time in the appropriate setting. That is the Green Mountain Care Board's charge, and they take that charge very seriously. And they thread a very fine needle with hospital sustainability, affordability with insurance rates, and now reference-based pricing. The Green Mountain Care Board has the authority to regulate hospital budgets and the qualified health plans. The Green Mountain Care Board is experienced and has the expertise required for this work. This is a process that has been in place for 14 years, and it is well established. The Green Mountain Care Board has the authority to implement reference-based pricing, and the Green Mountain Care Board is experienced and has the expertise required for this work, and they are excited to get moving on this. The amendment simply removes all the prescriptive amounts, and it allows the Green Mountain Care Board to do what they are statutorily required to do, and it just allows them to begin this in fiscal year 27. The amendment makes it very clear that the hospital budget process is under the purview of the Green Mountain Care Board, not the legislature. The title of this bill is Green Mountain Care Board and reference-based pricing. It is not Green Mountain Care Board and hospital budget review. I will now yield back to the member from St. Albans Town for Section 3.
The member from Essex yields to the member from St. Albans Town.
Thank you, Madam Speaker. The Appropriations Committee has the third instance of amendment, Section 4A, which is new. Starts on page 3622 and continues to 3623 in today's calendar. This takes language from the 2027 Appropriations Bill and puts it in this bill that authorizes the administration to submit a waiver 1332 to establish a program for reinsurance and seek federal pass-through funding. We heard from Ledge Council, the Joint Fiscal Office, the Chair of the House Healthcare Committee, and the Green Mountain Care Board, and the vote was 11-0-0.
Member from Essex.
Yes, your House Committee on Healthcare took a straw poll on the House Appropriations Committee amendment, and on a vote of 7-4-0, we found it favorable.
So the question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Are you ready for the question? Member from Castleton.
Thank you, Madam Speaker. Given the importance of making sure that we get this right, I guess I just want to start with the fact that healthcare and affordability are two of the most important issues facing Vermonters at this moment. And because of that, the importance of getting this right is so crucial and so key for all of us in this body. I do have a number of questions I'd like to ask the presenter of the amendment. And so at this point, can I interrogate the member from Essex?
The member from Essex is interrogated. Member, there's two sections. Are there the sections for healthcare or approach?
This is purely on healthcare, Madam Speaker.
Okay.
Yeah.
Member from Essex.
Thank you, Madam Speaker. I want to start with the chair's amendment and noting that there's no reduction cap. I'm wondering what prevents cuts that exceed what hospitals can reasonably absorb.
I'm sorry, member, I missed I could not hear the first part of your sentence. Can you repeat the question?
Absolutely. If the chair's amendment has no reduction cap, what prevents cuts that exceed what hospitals can reasonably absorb?
That is the purview of the Green Mountain Care Board. That is what the Green Mountain Care Board does now. That is a long, well-established process in rule.
Thank you, member. I note that the original bill contemplated at least a 3.5% limit tied to the hospital stability. The amendment removes that cap entirely. I'm wondering what specific protections now exist for hospitals, workforce stability, and patient access.
The same protections that have always applied.
So nothing has changed there.
We have changed nothing of current practice.
Thank you, member. Can the reporter point out to us any actual estimate of statewide premium savings of the bill?
No.
So to be clear, there is no reduction in premiums?
There will be reductions in premiums, but that amount will not be known until the Green Mountain Care Board completes their budget process and comes down with their budget orders and decides how much of hospital budgets they will incorporate into reducing rates in these plans. So therefore, no, there is no estimate because it's an unknown number now.
Do we know the number of Vermonters that are going to be impacted?
Yes, we do. Let's see, I think I saw just today, and of course in the QHP individual market, it's constantly shifting month by month. I think the number I saw today was that there are 22,000 in the individual, Actually, may I have a moment to consult with Joint Fiscal, who I know has those numbers sitting over with him, and I can tell you exactly.
The House is dead in recess. Will the House please come to order and members kindly take their seats? Member from Essex.
Thank you, Madam Speaker. So many numbers. There's currently approximately 64,000 in the QHP market and 34,000 in the VHI for just about 97,000 total.
Thank you very much, member. That's helpful. One of the things that we're constantly talking about in this body is the divide between rural Vermont and Chittenden County. And I'm curious if you can discuss the geographic distribution of savings.
That is an unknown number because the Green Mountain Care Board has not completed their hospital budget review process. That number will be known on October 1st.
All right, I will look forward to that day. And my last question in this section here is it known, and I assume not, given the line of questioning here, but the total reduction in hospital revenue statewide?
It is not.
So pivoting to another line of questioning here, I'm wondering why we are legislating broad reimbursement authority before we even know the answers to the most basic fiscal questions on this.
We gave broad reimbursement authority in Act 68 of 25.
But I'm curious, and I want to be careful here because I've asked the question once, but I do want to try to get an answer here. Why at this moment we're trying to do this when we can't answer some of the most basic fiscal questions?
I'm not sure there's an answer to that other than what I've already said is how can you answer a fiscal question when you do not know what the fiscal number is going to be? But I can guarantee you that when they know that number, they will be able to figure out the fiscal impact really quickly.
I hope so. And so, Madam Speaker, I think it's important just to double click on this point and for the clarity of all of us here in the body. The Healthcare Committee and the Money Committees did not see any analysis, including actuarial modeling, utilization analysis, hospital-specific impact estimates, or even consumer saving projections.
I'm sorry, was that a question?
Yes. Did you consider any of those financial elements in the testimony leading up to the bill coming to the floor? And I can repeat those 4 elements if it's helpful.
We have considered multiple financial elements over hospital budget guidance, which is just guidance. The Green Mountain Care Board puts out their guidance in March with their recommendations for hospital budgets to come in so that hospitals have a understanding about like where they're trying to work. Those hospital budgets come in July. Green Mountain Care Board goes through a long, rigorous process of review with all of those hospitals and then has final budget orders in August. There have also been numbers thrown around from the Vermont Association of Hospital and Health Systems regarding their promise to, they had actuarial analysis done where they could find savings of approximately $50 million in year 1, $50 million in year 2. And then there was recently the Mike Smith report, the liaison for the University of Vermont Network, University of Vermont Health. And he's indicating, and I think we've heard from the CEO of that entity, that they are committed to possibly finding $100 million per year for the next 3 years. So yeah, we've had a lot of numbers, hence why the numbers kept changing, and hence why it's not a good idea for the legislature to insert themselves into a process that is unknown at this point.
And I think that's exactly right, member, and that's part of my concern is that we do seem to be inserting ourselves in the process here. I think the numbers that you outlined.
Member from Burlington, what is your point of order?
Is that the member who's asking questions address questions through the speaker.
Member from Burlington, I find your point of order well taken. It is in Mason's that the conversations needs to be directed to and through the speaker. Member from Castleton.
My apologies, Madam Speaker. It's a bit awkward being 6'3" and trying to position myself with the seat, but I will do my best to direct the conversation through you to the body. So where I was going with this is it's interesting, and I understand the aspirational nature of the $50 million that was just cited to the body, the $55 million that was just cited to the body, the $100 million that was just cited to the body. But 5 minutes ago, we didn't know any financial aspects or considerations to this. And I fully appreciate the understanding that the fiscal year—
Point of order, Madam Speaker.
Member from Burlington, what is your point of order?
The reason for questioning is to elicit information and not to make an argument.
Can I see the members at the podium, please? The House will stand at ease. Will the House please come to order and members kindly take their seats? Will the House please come to order? Member from Burlington? Member from Burlington, I find your point of order not well taken. The member was providing information in support of his question. However, I do caution the member to keep opinion for debate, not interrogation. With that, member from Essex, the floor is yours. Or member from Castleton.
Thank you, Madam Speaker. The only other question I have, so there's actually two other questions here, and I thank the member for indulging me. What exactly are hospitals, employers, and Vermonters supposed to plan around here? Because we do not know how much hospitals may lose, how much premiums may change, how many Vermonters may benefit, whether savings will actually materialize, or what happens in future years. So I'm wondering if the member can explain how this legislature is expected to evaluate the long-term impact of the bill without any clearly defined fiscal endpoint, implementation framework, or a measurable statewide affordability target.
The legislature has already made that decision. That is Act 68.
Thank you, member. And my last question is, I saw on the witness list that Vermont Legal Aid was one of the organizations that testified. Is that correct?
The healthcare advocate is within Vermont Legal Aid.
And I'm curious what recommendations they made to the legislation.
They were part of a vigorous stakeholder group, and they shared positive opinions on the bill.
So there was, just to make sure I understand, member and Madam Speaker, there was no meaningful change recommended by Vermont Legal Aid that was incorporated in the legislation?
Not in the final legislation, and not in the, I believe we're on the amendment, and actually, no, that's in the underlying strike-all. There was meaningful addition in the strike-all, but we're on the amendment.
Thank you, member, and thank you, Madam Speaker.
So the question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Member from Morgan.
Thank you, Madam Speaker. May I interrogate the presenter of the amendment?
The member from which section, member?
Burlington.
Member from Essex is interrogated and may yield if it's the other part of the report.
Earlier in your statement, you described the reimbursement rate being at 300% of Medicare, and the following year dropping down to 50% of Medicare. For a critical access hospital that I'm here to represent, our Medicare population is over 70% of the revenue of that hospital. Has there been any indication from...
Point of order.
It's coming.
Member from Essex Junction, what is your point of order?
I think the questions are pertaining to the underlying bill and not the amendment.
Member from Essex Junction, I find your point of order well taken. The question that is being asked is not in this particular question. It would be in the next vote question. Member from Morgan?
Fine, I'll redirect my question to the next session. Thank you.
Member from Essex? No? Okay, so the question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Are you ready for the question? Member from Manchester.
Madam Speaker, about 64,000 Vermonters and businesses buy their health insurance from Vermont Health Connect, our state's Affordable Care Act marketplace. In January, many of us lost the federal tax credits that made these plans more affordable. It was a serious financial hit, and as we've learned today, more than 5,000 Vermonters have dropped their plans since then, while many others moved to bronze plans. This means higher deductibles, it means higher out-of-pocket costs, and that in turn means that people are avoiding getting health care when they need it because they can't afford it. In 2025, I was really glad to vote for Act 68, which is moving Vermont toward a reference-based pricing framework. And while that rulemaking process plays out, S190 will move things forward just a little bit faster for two important groups on the marketplace, the QHP plans for individuals and for small businesses, as well as for school employees. I think we're all trying to make life a little bit more affordable for Vermonters, and to make that happen wherever we can, as fast as we can. This bill delivers a pretty clear healthcare win, and I hope that folks will join me in voting yes.
So the question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Member from Barrytown.
Thank you, Madam Speaker. May I interrogate the member from Essex?
The member from Essex is interrogated.
Okay, I've just got a couple questions here. Hopefully there's no point of order coming. I think they're on the amendment. I'm just wondering, let's see. How can hospitals kind of responsibly plan for workforce access and services under a bill with no defined financial boundaries? If the chair's amendment applies to 14 hospitals and removes the reduction cap entirely, how are the hospitals supposed to assess the impact on staffing and capital investment, labor negotiations, and access to care?
Thank you, Madam Speaker. That's not addressed in the amendment, and that is part of, as well, the Green Mountain Care Board's long-standing hospital budget review. Hospitals will know their budgets because they submit their budgets to the board for approval, and then they know their budgets, so they can do all that planning.
Okay, thank you, member. I got a couple more here, but I'm going to save them for the underlying bill. Thanks.
So the question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Are you ready for the question? Member from St. Johnsbury.
Yes, Madam Speaker. The CEO of my local hospital, Critical Access Hospital, Northeastern Vermont Regional Hospital, has been holding monthly meetings with area legislators to talk about the financial challenges at NVRH and also North Country Hospital, which they are partnering with as much as they can. So I wanted to check with him about the status of this bill and especially this amendment. And he was very clear that this amendment is what makes the bill viable for him and for regional hospitals like NVRH. So I just wanted to let everybody know that this is a critical amendment to this bill, and I'd like to urge everybody to support it. Thanks.
The question is, shall the report of the Committee on Healthcare be amended as recommended by the Committee on Appropriations? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have amended the report of the Committee on Healthcare. Now the question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Healthcare as amended? Are you ready for the question? Member from Morgan.
Thank you, Madam Speaker. The basis of my question is, since they're going to be experiencing a reduction of 50 from the 300 to 250, have we been notified, or has the Green Mountain Care been notified of any future increases from the federal government on the reimbursement from Medicare? It's my understanding that it has not been increased for many years. If that happens, this could be very doable. That's my question.
Do you wish to interrogate the member?
From Essex, correct.
The member from Essex is interrogated.
Well, I will say that is not, the bill has been amended, so there is no 250 or 300. But I will remind members in Act 68, the Green Mountain Care Board is developing reference-based pricing, and we have given them this time to develop reference-based pricing so that it is tailor-made for each hospital within our state. Part of what the board is tasked with is that the reference set at your critical access hospital may be completely different than it is set at an academic medical center. The board has discretion to set the rates and to set the caps to meet the needs of each individual hospital. It is not, I thank the member for the question because, again, it allows me to stress how important the amendment from the Appropriations Committee was. Because if we had passed the bill as originally passed out of House Health Care, what we would have been doing is the legislature would have been prescribing a one-size-fits-all to all the hospitals. And that is not what we do. That was the reason for the amendment. So I thank the member. I hope that explains that, the Green Mountain Care Board, in their expertise, has wide latitude, and they are there to help hospitals, to keep our hospitals sustained. There are hospitals closing all over this country. And Vermont is lucky because we haven't lost one. And in part, that is due to the fact that we have the Green Mountain Care Board ensuring that our hospitals remain sustainable. That is why we are in a statewide strategic plan. That is why we are in hospital transformation. That is why we are working on hospitals working together to share services and find efficiencies. That is why we're doing this work. So thank you for highlighting it.
Thank you, Madam Speaker. I have no further questions.
So the question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Health Care as amended? Member from Berrytown.
Madam Speaker, may I interrogate the member from Essex, please?
The member from Essex is interrogated.
I've just got a quick may shall question. We all love the may shalls. And the Green Mountain Care Board, what happens if the Green Mountain Care Board decides not to act? Because the bill states many times they may implement reductions. Is it correct that the board could ultimately determine not to impose meaningful reductions at all and kind of leave Vermonters with no savings despite a significant disruption and uncertainty?
Thank you, member. If you'd just give me a minute to just read the amended bill real quickly. Or not the whole bill, but. It does say may, and I will say that the reason for the amendment was because the rulemaking process has not been completed, that all this amendment does is it says, notwithstanding the completion of rulemaking, the General Assembly says that the Green Mountain Care Board may move forward with reference-based pricing in these two markets. That's the reason for the may.
Okay, thank you, member. And then I just got one more here. If Vermont lowers QHP premiums now through this bill before completing its waiver strategy, could we be reducing the amount of federal support available to help Vermonters with premiums and healthcare costs in the future?
I'm not sure what waiver strategy. The Department of Financial Regulation has asked that we allow them to go forward with applying for a 1332 waiver. That process is several years long. I believe at the earliest something like that would be completed would be maybe 2028 if we are approved, which is not a sure thing. And it also requires, even if we are approved, that it would require appropriations from the General Assembly. I believe there might be actuarial information that the General Assembly would need to pay for. And then after that, it would then require more statutory guidance from the General Assembly to move forward because it would require a huge appropriation. So, I mean, I have heard at the earliest 2029, and we have tasked the Green Mountain Care Board with completing reference-based pricing across all the insurance markets by fiscal year 2029, which will be October of 28. And so therefore, moving forward 1 year early in the QHP market would not have any effect different than what is already happening because it will be completed before any 1332 waiver process would be completed. So no, we're not concerned about that.
Excellent. Thank you, member. Thank you, Madam Speaker.
The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Healthcare as amended? Member from Ferrisburg.
Thank you, Madam Speaker. I appreciate the work that the Healthcare Committee and Ways and Means and Appropriations have done on this bill. This is a really thorny issue, and the four major categories of goals that were outlined by the presenter of both the bill and the amendment are really lofty. I mean, authorizing a RFB, focusing the needs where they're met, focusing on those meeting the needs where they're most critical, reducing property taxes, that's a huge goal, and saving our hospitals. I mean, I don't know if those four circles all intersect, so I recognize this is a tough problem to solve. But I do have a couple of questions that I was wondering, given those four goals, if I could inquire of the presenter of the, what I guess now, bill.
The member from Essex is interrogated.
The original bill, the way it was stated, kind of had a statute of limitations kind of built into it based on the fact that we were at different years working through different levels of percentages for the Medicare adjusted rate. I'm wondering now, given the amendment, is there, I don't see in the amendment, is there some sunset on this provision? Because we're kind of targeting our savings toward these two specific groups, the qualified health benefit plans and the plans offered to school employees. That kind of leaves everybody else out. And I'm wondering, is there a sunset date on this when we're going to allow the plan to focus on everybody?
That's Act 68. And that process, we had asked for them to do the whole market beginning, that they shall begin in Hospital 2027. However, as I've explained, due to the length of RFPs and rulemaking, they will not have that completed by hospital fiscal year 27, 5 months away. However, reference-based pricing was Act 68, and Green Mountain Care Board will be doing reference-based pricing for the entire market until, I believe in Act 68, the reference-based price has been set, and then we will move to global hospital budgets. So there is no sunset.
Oh, okay, I think I understand the answer being that it's only in fiscal year 27 that the board may order the rates for these two specific groups. And after 27, then it goes back to the original Act 68 where they're focusing on everybody. Is that my understanding?
They will be focusing on everyone in fiscal year 28.
Yeah, okay.
Again, they will be completed with rulemaking in January of 27.
Okay, I think I understand that. Thank you. Thank you for that answer. That helps me. And then lastly, that third goal that was originally announced of reducing property taxes, and I know based on a previous member's line of questioning, we really don't know all the numbers, but did we set some kind of a target or some like an average? And I realize it's not a one size fits all, so the savings are going to vary across all the hospitals and user groups. But I'm wondering, was there some kind of a target set either for the savings or for the property tax reduction?
No, there is no target set because the number is unknown because the hospital budget process has not been completed.
Okay. Okay, thank you so much, member. Thank you. Yeah, so I guess I'm finding it a little challenging to claim that this bill is reducing our property taxes, that that's one of its main goals when we have really no idea at all, even if that's a possibility out of all this. But I do appreciate the effort, and I do appreciate the fact that we're, at least in 27, we're focusing some of the savings on teachers, which indirectly does kind of affect property taxes through the education funding. So I get that. And I thank you, member, for the responses.
Are you ready for the question? Member from Poultney.
Madam Speaker, this bill does not offer relief for the majority of employees and employers, both nonprofit and business, in the state of Vermont. It does not create any savings. In fact, 5 out of 6 Vermonters would see zero benefit. The bill simply makes our systems more expensive and more complicated. We need healthcare solutions that finally allow us to break free from the single-payer architecture. We need to make meaningful reform in healthcare for everyone and not just advocating for 15% of us. But just like other important challenges, we are here again with half measures that make no real impact, which allows for hand-picked winners and losers when all Vermonters need our support. We need real change with added choice and real reform for Vermonters. We cannot continue to dance around the issues when we need significant, systematic change, be it in healthcare, education, or housing. This bill falls short. I will vote no, and when the vote is taken, I request it be taken by roll.
The member from Poultney requests that when the vote is taken, it be taken by roll. Is the member sustained? The member is sustained. When the vote is taken, it will be taken by roll. The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Health Care as amended? Member from Burlington.
Thank you, Madam Speaker. Madam Speaker, Vermont has the highest healthcare costs in the country. This body has studied this in detail, and Vermonters have mourned it at kitchen tables across the state, especially this year. today with S190, we have an opportunity to actually do something about it. This bill is about one fundamental principle. Vermonters should not be charged whatever a hospital decides to charge. There should be a limit, a rational, transparent, publicly accountable limit, and that limit should be tied to something real. S190 directs the Green Mountain Care Board to use Medicare rates as the benchmark and to bring commercial hospital prices down to the national median by 2030. This isn't a radical idea. This is just asking Vermont hospitals to charge what hospitals in the rest of the country charge. Right now, some Vermont hospitals are billing commercial insurers at rates that are many multiples of what Medicare pays for the same exact service. Those inflated rates flow directly into the premiums that Vermont families who purchase on the marketplace, small businesses and nonprofits, and school districts pay every single month. And when the school district pays steeply increasing health insurance premiums, Vermont property taxpayers see unmanageable year-over-year increases. The people who are paying for that choice are the very constituents who have been asking us to make life in Vermont more affordable. S190 also addresses something that has gone unexamined for too long, what Medicare beneficiaries that are critical access hospitals face when they go in for outpatient care. S190 doesn't solve the federal problem, but it stops pretending that the problem doesn't exist. Older Vermonters living in Addison, Caledonia, Essex, Lamoille, Orange, Orleans, Windsor, and in rural Windham County deserve more affordable care, and S190 helps to lead the way. And critically, this bill requires that when hospital prices come down, insurance premiums come down with them. The Green Mountain Care Board and the Department of Financial Regulation will be watching that alignment publicly every year. No more of the savings going somewhere other than into the pockets of the people who need relief. S190 is a start, not a finish. Reference-based pricing is a powerful tool, but it is one piece of a larger puzzle. What S190 does is to ensure that our system structure, the authority, and the accountability to begin bending the curve in a meaningful way. The Green Mountain Care Board now would have the explicit authority that they need to demand price moderation. S190 closes the loophole that would have allowed hospitals to negotiate their way around caps through provider bargaining groups, and the bill requires the board to report publicly every year on whether or not price moderation is making a difference in our premiums, so Vermonters can see the impact for themselves. Vermont families deserve health care they can afford. This bill takes a serious step towards that. This is the kind of legislation that we are all here for this session. I urge my colleagues to support it.
Are you ready for the question? Member from Essex Junction.
Madam Speaker, I am voting yes for affordability, for Vermonters, and for our hospitals. S190 directs the Green Mountain Care Board to do this work. That is their role, and they testified multiple times in the Healthcare Committee that they want to do this work. They have the expertise and the statutory requirement to control costs for Vermonters. S190 will make premium cost lowers for individuals, small businesses, and will provide cost savings to our education fund, which will have a direct effect to help property taxpayers. S190 will also impact Vermonters in all 14 counties. S190 will help Vermonters be able to actually use their health insurance, which in turn helps our hospitals. Right now, utilization is decreasing because Vermonters have lost or can't afford to use their health insurance. This will lead to increased bad debt and charity for hospitals. S190 is the most important health care cost control legislation Vermont has considered in over a decade. I'm voting yes, and I urge the body to vote yes.
Are you ready for the question? If so, will the clerk please call the roll?
Arsenault of Williston.
2 minutes. Will the House please come to order? Will the House please come to order and members kindly take their seats? I would like to remind members that we are in the middle of a roll call vote. Members and guests are prohibited from using computers, phones, or any type of electronic device. Please refrain from the passing of notes and conversation during a roll call. And when the clerk calls your name, please answer in a loud and clear voice so the clerk can accurately record your votes. The question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Health Care as amended? Will the clerk please call the roll, continue to call the roll?
Austin of Colchester. Bailey of Hyde Park. Bartholomew of Heartland. Bartley of Fairfax. Burbeck of Winooski. Byrong of Regents. Bishop of Colchester. Black of Essex. Bloomley of Burlington. Boston of Westminster. Bosch of Clarendon. Boonberry City. Boyden of Cambridge. Brady of Williston. Brannigan of Georgia. Brigham of St. Albans Town. Brown of Richmond. Burdett of West Rutland. Burker Brattleboro.
Yes.
Burkhardt of South Burlington. Burrows of West Windsor. Burdick Habit. Campbell of St. Johnsbury. Canfield of Fairhaven. Pierce Duncan of Whitingham. Casey Montpelier. Casey Hubbardton. Chapin of East Montpelier. Charlton of Chester. Christie of Hartford. Chena of Burlington.
Yes, with explanation.
Coffin of Cavendish.
No.
Cole of Hartford. Conlon of Cornwall.
Yes.
Cooper of Pownell.
Yes.
Corcoran of Bennington.
Yes.
Critchlow of Colchester.
Yes.
Demar of Venusburg.
No.
Dickinson of St. Albans Town.
No.
Dobrovich of Williamstown. Dodge of Essex. Dolan of Essex Junction.
Yes.
Dogan of St. Johnsbury.
No.
Donahue of Northfield.
Yes.
Duke of Burlington.
Yes.
Durfee of Shaftesbury. Eastus of Guilford.
Yes.
Emmons of Springfield.
Yes.
Feltus of Linden.
Yes.
Guelph of Berrytown. Garifano of Essex. Goldman of Rockingham. Goodnow of Brattleboro. Ghostland of Northfield. Granting of Jericho. Greer of Bennington. Gregoire of Fairfield. Hango of Berkshire. Harpel of Glover. Harvey of Castleton. Hedrick of Burlington. Higley of Lowell. Holcomb of Norwich. Hooper of Randolph. Houghton of Essex Junction. Howard of Rutland City. Howland of Rutland Town. Hoyt of Hartford. Hunter of Manchester. James of Manchester. Kosenska of Burke. Keyser of Rutland City. Kimball of Woodstock. Klepner of Burlington. Kornheiser of Brattleboro. Krasnow South Burlington. Labor of Morgan. Lally of Shelburne. Lalona South Burlington. Lamont of Morristown. LaRush of Franklin. Lipsky of Stowe. Logan of Burlington. Long of Newfane. Long of Milton. Leaders of Lincoln. Luno of St. Albans City. McGuire of Rutland City. Malay of Pittsford. Marquardt of Coventry. Maslin of Thetford. McKenna of Montpelier. McCoy of Pulteney. McGill of Bridport. Mickless of Milton. Mahali of Callis. Minier of South Burlington. Morganella Milton. Morgan Emma Milton. Morse of Springfield. Morrissey of Bennington. Morrow of Weston. Rowicki of Putney. Nelson of Derby. Nielsen of Brandon. Niagara of Bennington. North of Ferrisburg. Noyes of Woolkett. Nugent of South Burlington. O'Brien of Tunbridge. Odie of Burlington. Oliver of Sheldon. Olson of Starksboro. Page of Newport City. Parsons of Newberry. Pezzo of Colchester. Pinson of Dorset. Pouch of Heinsberg. Powers of Waterford. Priestley of Bradford. Pritchard of Pollitt. Quimby of Linden. Richardson of Burlington. Sakowitz of Randolph. Shy of Middlebury. Scully of Burlington. Sheldon of Middlebury. Sibilia of Dover. Susie of Berrytown. Southworth of Walden. Squirrel of Underhill. Steady Milton. Stevens of Waterbury. Stone of Burlington. Sweeney of Shelburne. Taglia Crint. Taylor Menden. Tomlinson of Winooski. Torrey Moortown. Walker Swanton. Wazoo Zachary City. Waters Evans of Charlotte. Wells of Brownington. White of Waitsfield. White of Bethel. Winter of Ludlow. Wood of Waterbury. Yakavoni, Morristown. Burdick Habit. Casey Hubbardton. Christy of Hartford. Cole of Hartford. Dodge of Essex. Garifano of Essex. Hooper of Randolph. Lowley Shelburne. McGuire of Rutland City. Malaya Pittsford. Morganella Milton. Niagara Bennington. O'Brien of Tunbridge. Parsons of Newberry. Pinson of Dorset. Rachelson of Burlington. Walker Swanton. Wells of Brownington. Winter of Ludlow.
For purpose of explanation, member from Essex.
I have spent this biennium as the chair of House Healthcare, laser focused on one thing, ensuring that Vermonters have access to high quality healthcare that they can actually afford. I am proud to vote yes on S190. I have heard Vermonters, and I have done my part.
Member from Westminster.
Thank you, Madam Speaker. H190 provides policies that will control the cost of health care in Vermont. These will lower hospital costs and premiums, making health care in our state more affordable for all Vermonters when they need it, closer to home.
Member from Burlington.
I vote yes to control cost and to preserve access to care in every corner of Vermont. The failure of a privatized, for-profit, insurance-driven system can be resolved by fulfilling the promise of Act 48. Healthcare is a human right.
Member from Castleton.
The statutory purpose of the Green Mountain Care Board is to reduce the rate of growth in expenditures for all payers. S190 fails to do that, putting it at odds with the very purpose of the Green Mountain Care Board.
Member from Burlington.
Other rural states like Montana have saved tens of millions of dollars with reference-based pricing without affecting access. I'm delighted we are taking this proven, straightforward step to finally start reducing healthcare costs for Vermonters.
Member from Morgan.
I voted no, and I've been a provider of healthcare forever. And now I'm a consumer of healthcare, so I am concerned about the costs. I'm concerned mostly about the Medicaid population in our area that we're serving. There are no assurances that reference-based pricing as described to us today have any guardrails. We are not being provided with enough financial information just a hypothetical promise of sustainable dollars. We need more information. Thank you.
Member from Milton.
Madam Speaker, this bill does not help as many people as we'd like, but I voted yes because helping some of the people is better than none. The real answer is to open up our markets to other healthcare providers and spur competition. I hope we can pass legislation to make that easier.
The other member from Milton.
Madam Speaker, I have concerns about getting Vermonters' hopes up when we haven't heard any actual savings from this bill. How many Vermonters it would actually benefit? And I'm not sure how this would work, if hospitals took a loss, would that mean people like me that might not benefit from this bill would get my prices raised and cost me more? And my husband and I are retired. So with all these unknown answers and questions, and I have to do what's best for Vermonters, and that's why I voted no.
Member from Waitsfield.
Madam Speaker, S190 takes the first step towards reference-based pricing in Vermont. Every healthcare professional I have spoken with about our healthcare crisis has said that we must adopt reference-based pricing to bring costs under control. This bill begins by addressing the cost of healthcare for teachers, individuals, and small businesses. Teacher healthcare costs are up no less than 25% in the last few years. This bill addresses educator healthcare costs, which were the largest contributor to property tax increases. This bill addresses affordability for all Vermonters, and I am proud to support it.
Member from Morristown.
Madam Speaker, it's been said before, if you always do what you always did, you'll always get what you always got. And I am tired of getting the highest health insurance rates in the world. I stand proudly today in taking a step toward affordability for Vermonters.
Members, please listen to the results of your vote. Those voting yes, 87. Those voting no, 44. The ayes have it, and you have proposed to the Senate to amend the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Member from Poultney, can you please offer us a motion to suspend rules to place Senate Bill 190 in all remaining stages of passage?
Madam Speaker, I make a motion to suspend rules in order to place S197 in all remaining stages of passage.
The member from Poultney moves that we suspend our rules to place Senate Bill 190 in all remaining stages of passage. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have placed Senate Bill 190 in all remaining stages of passage. Please listen to the third reading of the bill.
S190, an act relating to the Green Mountain Care Board, reference-based pricing, and studying the creation of a public employee health benefit authority.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have passed the bill in concurrence with proposal of amendment. Member from Poultney, can you please offer us a motion to suspend our rules to message our action on Senate Bill 190 to the Senate forthwith?
Madam Speaker, I make a motion to suspend rules in order to message our actions on S190 to the Senate forthwith.
Member from Poultney moves that we suspend our rules to message our action on Senate Bill 190 to the Senate forthwith. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended our rules to message our action on Senate Bill 190 to the Senate forthwith. Members, at 3:09 today, the clerk emailed you all the Committee of Conference report on House Bill 660, which is an act relating to fiscal year 2027 opioid abatement special fund appropriations. The report is also posted on the House Overview webpage, and paper copies are available at the main table. Member from Poultney, can you please offer us a motion to suspend rules to take up House Bill 660 for immediate consideration pending its entry on the notice calendar?
Madam Speaker, I make a motion to suspend rules in order to take up for immediate consideration pending its entry on the notice calendar H660.
The member from Poultney moves that we suspend our rules to take up House Bill 660 for immediate consideration pending its entry on the notice calendar. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up House Bill 660 for immediate consideration. House Bill 660 is an act relating to fiscal year 2027 opioid abatement special fund appropriations. The bill was referred to a committee of conference on the disagreeing votes of the two chambers. The Committee of Conference has met and considered the same and recommends that the House adopt its report, which is printed in today's calendar. Member from Waterbury.
Thank you, Madam Speaker. The members of the House Conference Committee and the Senate Conference Committee agreed unanimously to this report of the conference, as you so noted, was distributed to members at 3:09 this afternoon. I will also point members to a very helpful spreadsheet on my committee's website if you are interested in following along. The primary disagreements were between the amounts appropriated to what areas, and so I'm going to just briefly review those for you now, including what this bill does. And just to remind members that this is a separate appropriation because it's a special fund. And so these monies are not included in the budget. They are in a special fund. The House and Senate both had agreed to monies for outreach and engagement staff for preferred substance use providers, as well as money for recovery residences and ongoing operational funding, syringe service programs, and peer recovery services. We also provided resources for substance use services at emergency shelters. And the next item is an item where we had a point of disagreement. And in the House version, we did not have funding for recovery centers. The Senate version had $800,000 for recovery centers. And in the Committee of Conference, we agreed on $500,000. Another area of disagreement was in the opioid recovery employment program. Those are specialized vocational rehabilitation counselors who work with individuals with substance use disorder. In the governor's budget, that was included in the base budget for the Department of Disabilities, Aging, and Independent Living in the Higher Ability Division, and that is $875,000. It had previously last year been funded from the opioid settlement fund, And we are again this year funding it in the opioid settlement fund, and that's $875,000. We agreed to that in conference committee. There was $1.1 million appropriated in the Senate version for the Overdose Prevention Center in Burlington. The House did not have that in its passage of H660. And your House Committee on Human Services took further testimony on this issue and found that our position was the position that we wanted to stick with, and we were successful in doing that. And so 1.1 million was removed from H660. The Overdose Prevention Center has a grant with the Department of Health that will take them all the way through FY27, so there was no need to appropriate funds for that purpose in H660. Another area of disagreement was between the amount of, or the language, not really the amount of money. We had both appropriated $1.2 million for recovery services, residential recovery services, and the Senate had divided that up between recovery residences, which are a peer-supported model, and recovery treatment, which is a medical service at level 3.1 of the American Society of Addiction Medicine. The Department of Health really would appreciate additional flexibility in that, and we wanted to adopt language that included serving unserved and underserved areas of the state. So the dollar amount did not change. We just, you will see language that says that we will essentially fund both of those, but give the Department of Health some flexibility about how that will be done. In the House version, we had 4 prevention programs that were funded out of the opioid abatement special fund, and in the Senate version, they moved that to the substance misuse prevention fund, which is actually where we preferred to have those taken. So we definitely agreed with that. And so, Madam Speaker, at the end of our conference committee, we agreed on a unanimous vote and hope that the body supports that.
The question is, shall the House adopt the report of the Committee of Conference on its part? Member from Cavendish.
Madam Speaker, may I interrogate the presenter of the Committee of Conference report?
The member from Waterbury is interrogated.
Thank you, Madam Speaker. I'm looking for a little clarification here. I thought I heard it said that we are not giving $1.1 million to the city of Burlington for an overdose prevention center. Is that correct? Or are we?
We are not appropriating in H660 $1.1 million.
Okay, I'm looking at the Committee of Conference report, H660, and Section 2, Legislative Intent, Overdose Prevention Center. I'm seeing a figure in there of $1.1 million for the Department of Health for the purpose of awarding a grant to the City of Burlington for the work of the Overdose Prevention Center. Is that Section 2 part of this Committee of Conference report? I'm just curious, unless I'm reading it wrong.
Member, we are talking Section 2, and that Section 2 identifies that if the Overdose Prevention Center has located a site and has found that suitable, that they could apply through the Budget Adjustment Act for action by the General Assembly. This bill does not appropriate $1.1 million, but it identifies a process by which the center could seek up to $1.1 million next year during the budget adjustment process.
Thank you, Member. And where would that money come from again?
If that was approved, that would come through the Opioid Abatement Settlement Fund.
Madam Speaker, was there any discussion of how much Burlington has spent of the 1.1 they had option to last year?
Yes, Madam Speaker. The Vermont Department of Health has entered into a development grant with the City of Burlington that has allocated $2.2 million. And of that, approximately $300,000 has been spent. It is why that the House position was that no further money in this bill was required at this time.
So if that money is already earmarked, my question would be, why are we earmarking more of it to say that we will fund this and continue to fund it? That's my question, is how are we continuing to fund it if that money is sitting there?
The development of a overdose prevention center requires considerable amount of work at the local level in terms of community meetings and development work. A site has not yet been located. When a site is located, there will be expenses associated with fit up of that site and the leasing or possible purchasing of that location, and the resources. There are 4 programs within the overdose prevention, the overdose abatement settlement fund that had previously been established in statute as receiving annual funding as long as the funds exist in this special fund, and this was one of those 4.
Thank you. That's all the questions I have. Now for some commentary, if I may, Madam Speaker. We've had approximately a 25% decrease in overdoses since over the last year. That's without this so-called Overdose Prevention Center, which by just reading its intent is an enabling center. When we look at the statistics, without the Overdose Prevention Center, we are lowering the amount of overdoses by getting people actual training. Even reserving and giving the option for $1.1 million, where a teenager, where a 12-year-old, a 13-year-old can go in and get promised a clean room to use drugs, to use illegal drugs. And all they have to do is keep a record of, oh, well, we gave them a referral somewhere. They don't have to do anything. This does nothing to encourage the lack of drug use. When I read about the intents, part of it is a smoking room. But don't worry, we'll make sure that the smoke doesn't get to the rest of the building. We'll make sure there's clean, sterile rooms for them to use illegal drugs. This is enabling young people to continue to use illegal drugs. There's nothing. I voted for 660 when it left this chamber because it had no funding for a drug enabling center. This encourages young people to continue to use. It does nothing to stop them from using. Real treatment centers, 1.1 million more dollars to real beds. How many hundreds of thousands do we have just providing needles to addicts? But yet, our citizens with diabetes have to pay for them. This is a misuse of funds. If this is for opioid abatement, it should be to stop people from using drugs, to help them not use drugs, so that they can continue and actually have a life, instead of being addicted and counting on the system to take care of them, where they would actually learn to take care of themselves. To grow up to be, and I say grow up because yes, there are people my age is addicted, that are addicted still, that are still using. By getting clean, you grow up. Yes, you have to face reality. Giving them someplace to slip away from reality just so they can do it safely. Adulting is hard. We shouldn't try to distract our youth from it. This is an abomination, not a compromise, but helping to poison our citizens. I would ask this body to vote no on this because this is not a compromise. At best, we're compromising with other people's lives instead of getting them real help. Thank you, Madam Speaker.
So the question is, shall the House adopt the report of the committee conference on its part? Are you ready for the question? Member from Burlington.
Madam Speaker, I'd first like to apologize for all the people in Vermont who were subjected to that hateful speech. If you're
Point of order,
struggling
Madam
out there,
Speaker. Point of order.
Member from Lowell, what is your point of order?
Yeah, he's impugning what the member had reasonable remarks to make.
Can I see members at the podium, please? The House will stand at ease. Will the House please come to order and members kindly take their seats? Will the House please come to order? Member from Lowell? Member from Lowell, I find your point of order well taken. Members can't indulge in personalities in debate. Member from Burlington, the floor is yours.
Madam Speaker, the words that we use in our debates have an impact, and I apologize to any members of the public harmed by any speech they hear in this chamber that triggers them and that escalates underlying medical conditions. Addiction is a medical condition, Madam Speaker, and an overdose prevention center is a venue to provide care to people without shame, a place to destigmatize their problem and connect them with resources. So I just want to remind members that our words may cause harm, intended or not. And I hope that no one hears anything we say and that doesn't drive their addiction and drive them to the point of an overdose, because if that happens, the blood is on our hands. Thank you.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? Member from Waterbury.
Thank you, Madam Speaker. I want to acknowledge that there are many strongly held opinions about an overdose prevention center. I also want to acknowledge that the establishment of a pilot project for this overdose prevention center was established by a previous legislature. It is not being debated in this bill, Madam Speaker. This bill makes appropriations from the Opioid Abatement Special Fund. There is no appropriation for the Overdose Prevention Center in this bill. What the bill acknowledges is the prior commitment of a previous legislature that if funding is needed, that the City of Burlington, through the Department of Health, may apply for funding, and then this body will make that decision at that time. I also want to speak to the fact that we are seeing a reduction in overdose deaths. We are seeing a reduction in overdose deaths because of the variety of resources and techniques that the state has employed, largely through the collaboration with the Department of Health, with our community providers, and with this body, Madam Speaker, to focus on not only treatment and prevention, but on harm reduction in our society and in our communities. And I make the argument that each life saved is valuable, and I hope that the body stands with the Committee of Conference, as again, that was a unanimous report from the Committee of Conference. Thank you.
The question is, shall the House adopt the report of the Committee of Conference on its part? Member from Burlington.
Madam Speaker, overdose prevention centers have one simple goal, and that is to prevent Vermonters from dying. They are not meant to get someone through the process of recovery. They are meant to keep Vermonters who have substance use disorder alive one more day, so they have one more day's chance to get into recovery. Madam Speaker, may I quote from the National Institutes of Health?
You may.
Extensive global and local research shows that overdose prevention centers do not increase drug use. Studies across North America, Australia, and Europe indicate they do not cause new people to start using drugs, nor do they result in an increase in local crime or public disorder. Thank you.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? Are you ready for the question? Member from Burlington.
Thank you, Madam Speaker. Madam Speaker, 170 Vermonters died from overdose deaths last year. Overdose prevention centers have been demonstrated to increase access to treatment, health services, and most importantly, prevent deaths. I know that I'm not entirely sure why we're relitigating this policy at this moment, but I will stand to defend the work that we have done in prior sessions. I stood similarly in support of H72 when we passed it in the prior session, and spoke about my own personal experience as well. So my sister had what is called a dual diagnosis, suffering from both a substance use disorder and a severe mental health issue. And the NIH estimates that nearly 40% of those suffering from substance use disorders also suffer from at least one serious mental health issue. Both of these health issues are deeply stigmatized. They're seen as a character issue, or in my family's case, a spiritual defect. And this shows up in our communities as a lack of resources dedicated to these deadly diseases, such as adequate health care, as well as criminalization and disrespect. My sister suffered from the dual stigma of mental illness and drug use. She felt low self-esteem, shame, hopelessness, and wouldn't openly talk about her struggles with my parents or with virtually anyone else. In October 2006, my parents lost one of their daughters, my children lost their aunt, and I lost my only sister. She died alone of an accidental overdose when she relapsed after 9 months of sobriety. My mother found her. I support overdose prevention centers so that nobody has to die alone.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have adopted the report of the Committee of Conference. Members, at 3:04 today, the clerk emailed you the Senate proposal of amendment on House Bill 757, which is an act relating to manufactured homes and limited equity cooperatives. The Senate proposal of amendment is also posted on the House Overview webpage, and paper copies are available at the main table. Member from Poultney, can you please offer us a motion to suspend rules to take up House Bill 757 for immediate consideration, pending its entry on the notice calendar?
Madam Speaker, I make a motion to suspend rules in order to take up for immediate consideration pending its entry on the notice calendar, H757.
The member from Poultney moves that we suspend our rules to take up House Bill 757 for immediate consideration, pending its entry on the notice calendar. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up House Bill 757 for immediate consideration. House Bill 757 is an act relating to manufactured homes and limited equity cooperatives. The bill passed the Senate in concurrence with a proposal of amendment. Member from Colchester.
Thank you, Madam Speaker. H57 modernizes our law concerning manufactured or mobile homes and communities. The House passed H757 on March 18th, 2025. The Senate has now passed the bill with several instances of amendment. Your General and House Committee has reviewed the amendments to H757 proposed by the Senate and recommends that the House concur with the Senate amendments. 3 of the Senate amendments relate to provision in the House bill, which makes it easier for manufactured home communities organized as limited equity cooperatives to apply for grants for infrastructure improvements. Such grants and loans are of major importance to most manufactured home communities and to address aging and deteriorated infrastructure. The Senate proposes a 2-phased approach instead. It lets the House provision stand for a year, and in the interim directs the Department of Housing and Community Development in consultation with the Agency of Administration, the Agency of Natural Resources, and the Agency of Transportation to prepare a report identifying all the state grants and loans programs available to mobile home parks for infrastructure improvements and to analyze the eligibility regulatory barriers that may exist, especially for limited equity cooperatives. The report is due on November 15, 2026, and the Senate proposes to then sunset the House provision on July 1st, 2027. The House also contained sales and use tax exemptions for mobile homes effective January 1st, 2027. The Senate pushes that date 1 year to January 1st, 2028. Your General and House Committee reviewed these Senate amendments and by a straw poll of 902 recommends to the House that we concur with the H757 as amended by the Senate.
And now, member from Berry City.
Madam Speaker, your House Committee on Ways and Means reviewed the Senate proposals of amendment to H757 and on a vote of 11-0-0 recommends that the House concur with the Senate proposal of amendments and asks for your support.
So the question is, shall the House concur in the Senate proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have concurred in the Senate proposal of amendment. Members, at this time, we have one bill left for consideration, which is House Bill 954, which is the Stowe charter change, and I believe the committee may be hearing it now. So the House is going to take a recess. So the House will stand in recess until the fall of the gavel at approximately 6:35. The House will stand in recess until the fall of the gavel at 6:35.